Good day, folks. Alfie Vente here once again at Vente Pain Relief Clinic and VPRC.ca. Today I'm doing a short commentary. It's basically on a writing from Health and Fitness Journal from the American College of Sports Medicine. It's called Defining an Individualized Functional Range of Motion in Resistance Exercise for the Shoulder. Very long title. By doctors Emilio, Landolfi, and Rogerio. I hope I'm pronouncing that right. Rogerio, Roger Bernardes, both PhDs. This is from volume 28, number 4, July, August 2024. So I think this is the latest edition. I was flipping through this. And the reason why I'm doing this commentary is I'm very big on proper technique when exercising, and there's a lot of things here that I can relate with, and it in regards to injury prevention. I myself have had a shoulder injury. I've had a pectoral tear, so I understand where this is coming from, and it actually highlights a lot of things that I believe people should be very, very wary in terms of when they're doing certain exercises, particularly with the shoulder. So we're going to go on to this article. But before I go into that, please like, share, subscribe, pass this on to those that you feel this might be helpful for. We want to thank you in advance. So here we go. A number of key points from this article, from this paper, is that exercises should be based on safe and effective range of motion versus the general belief of using full range of motion. Now, that's a very common belief at, when you're going to the gym. You hear it all the time. Make sure you're going through the full range of motion, when you're doing certain exercises. That could be like from doing squats all the way to shoulder presses, to bench presses, so on and so forth. But I have to tell you that that is not necessarily the case with a lot of people, in that full range of motion may not be possible. And when I'm talking about full range of motion, I'm talking about the textbook definition of what a full range is for that joint. It may not be possible for certain people. It might be unsafe for a number of people, particularly if they're not very flexible, and you're getting them to go through a range of motion, or you're getting yourself to go through a range of motion that your muscles may not be flexible enough to go through, or your connective tissue, may not be that flexible, and it could lead to injury. Also, injuries occur when exercises are performed using improper technique beyond safe range. And sometimes when I go to the gym, I see people going and doing these exercises, and they're doing improper techniques so that they can get a set done, or they're very fatigued and they're continuing on with their exercises, and the technique goes off and they go beyond a safe range. That can lead to potential injuries for sure when you're tired and your technique is off. And here's another key point. These aren't all the points, by the way. I'm just doing a short summary of the things that I found that stood out for me as a therapist, and stuff that I can really relate with. Range of motion should be individualized as it pertains to exercise. It's kind of going back to point number 1, in that range of motion, again, for myself, I've never seen somebody with perfect range of motion, or the textbook range of motion, the stuff that you see in textbooks. In fact, there's people that are more limited than other people, but it's more normal for them. For example, I could have a gymnast coming in, and they're more flexible than most people. I could have somebody coming in, and they're basically not as flexible. Maybe they have a shorter range of motion, but maybe that's more kind of a genetic thing for them. Certainly, you can improve the range of motion, you can improve the flexibility, but there is a limit to how far a person's flexibility can get better. So that's something to take note of. The other thing too is, like with the range of motion, if you're not doing a lot of flexibility exercises, and your muscles are becoming super, super tight, and you're trying to get through that full range of motion, it may not be the best thing for you in regards to the exercise being safe for you. I know, because with my pec tear that I had years back, I wasn't doing much stretching. I wasn't doing much in terms of flexibility. I was going through the full range of motion. I was doing a lot of crazy things, and eventually it led to a tear of my left pectoral. And the final point is that the shoulder is the most commonly injured joint. The shoulder is commonly injured because it's the most mobile joint in the body. It's got a lot more freedom than, say, the knee, for example, or the elbow, even the hip. So there are, with the amount of mobility there is, there's also a decrease in the amount of stability. So the more mobile a joint is, the more unstable it can become also. So those are the key points that I found. Again, like if you're reading the article from the ACSM Health and Fitness Journal, you might be, as a therapist, you might be able to pick up a lot more. But again, this is more of a short commentary. So, in the article, in the paper, they talk about many different examples of exercise. I've got 4 for you that I find that I can relate with. That I myself, when I'm exercising, I'm really, really careful with the technique, and also passing on what I know to patients. It can be very helpful in terms of potentially preventing injuries. One of the things I have to mention is that before I was a massage therapist, I was actually a personal trainer. So I did a lot of training, I taught the techniques. A lot of this stuff is basically back from when I used to train. A lot of the stuff that I'm talking about now. So number 1, you see here the example of number 1. This is a bench press. Now, if you take notice, you'll notice that with this person, that they've got a wide grip. They've got a wide grip. Okay, like wider than usual. Typically, you want to be a bit more further apart, maybe an inch apart from your shoulders when you're doing a bench press. This person is fairly wide in terms of the way their hands are positioned. This is not a great position for your shoulder, in that if you're not that flexible, you're in this position here and you're bringing it down, it can cause potential injury over time, or potentially traumatic injury. Like if you're doing a certain type, a certain set, and your muscles aren't that flexible, your connective tissue is not that flexible, it can cause potential injury. In fact, with this exercise, the idea is that you get more of the pecs working. Typically what happens is that it's either lowered to the upper portion of your chest with the wide grip, or closer towards your neck, as alluded in the article, in the writing. So this is one thing that you have to be aware of. Sure, it may get a bit more of the pecs, but you have to balance out the safety aspect of it. And again, if you're not very flexible around the shoulders, this is not something that you really want to do. And number 2 right here, this one is a common one. I remember back in the day, trainers would say, make sure you get that full range of motion, get that stretch. But unfortunately, this exercise here, if you're not that flexible, this can cause overstretching injuries. Not to mention that with this positioning here, if you've got already lengthened rhomboids, the muscle between your shoulder blades and middle trapezius, if your pecs are very short and you're doing this exercise, what you're doing is you're feeding more into the problem where you're rounding your shoulders. What you want is your shoulders back and down when you're doing these exercises, not going through that full range of motion. But I also have to add that in certain cases, for example, bodybuilding, they may want to get the full range of motion because you potentially could get more of the muscle worked. But again, we're looking at balancing safety and also safety, performance, and making sure that you're not potentially going to injure yourself. So that's examples 1 and 2. Let's check out the other ones here. Here's another one of my favorites. Example number 1 here is the lat pull down behind the neck. So the lat pull down behind the neck is not a very good position for your shoulder for a number of reasons. First of all, we talked about the flexibility around the shoulder. If it's very, very tight, you can have issues with the rotator cuff with this type of exercise here. Not to mention, in the next slide, I'm going to show you something that we call an impingement syndrome, or an issue that will cause impingement of the shoulder. And this is a very bad position for your shoulder to be in this position here, because potentially tendons can get impinged on this bone here, the acromion, when you're raising your arm up. So this is probably not the best position in terms of you doing the lat pull down. You should be doing more at the front. And the second one here, this one is more about the grip. Again, this is, although it's the the chin up, it's kind of similar to the bench press in that could cause a lot more pressure around the shoulder, particularly when your grip is a lot wider. Potentially, you can get more of an overstretch. Also, when you're bringing yourself down. So those are two kind of exercises. For the types of like techniques for the shoulder that you have to be very, very aware of. A lot of this comes down to the amount of flexibility you have in your shoulder. And again, if you're not doing a lot of stretching, a lot of flexibility exercises, then potentially you can over time hurt yourself or have that one-off traumatic injury like I did. So as I mentioned, these are the tendons that may become impinged. So here on the left-hand side with the skeleton here, I'm pointing to the biceps tendon. Okay, so this is where your biceps runs into the shoulder blade. And here on this side, this is the shoulder blade or the scapula, and I'm pointing to a muscle called the supraspinatus, which is one of your rotator cuff muscles. And I'm also pointing to something called the acromion. It's that bony outcrop there. And what happens is that at times, when you're raising your shoulder, this tendon and that tendon can become impinged on the acromion, especially if your shoulders are all the way back and you're doing things like lat pull downs or shoulder presses. So on to the next slide. So you see on the left hand side here, I'm going to show you two different positions for your shoulder. So yeah, they're two different exercises, but basically if you notice on the left hand side here, you'll see that this man's his elbows are slightly a bit more forward, almost 30 degrees. This is a position that it's a position called scaption, where your humerus, your arm bone is slightly forward, and that puts the tendon of the supraspinatus and the biceps tendon out of harm's way from the acromion. Whereas with this guy here on the right hand side, you'll notice that he's doing a shoulder press behind the back, and you'll notice that his elbows are all the way back. Now again, this position for your shoulder is not the greatest, because if your flexibility, one more time, is not very good, you can cause potential injury in the area. And also the fact that your shoulders are back this way and your arm bone is back this way, you can have a chance of potentially impinging. Let me go back here. The supraspinatus tendon and or the biceps tendon, causing potential pain in the shoulder and when you're raising your arm up. So in essence, what you want is the arms slightly forward when you're doing exercises such as the lat pull down or the shoulder press. So any kind of like movement that you're kind of using the shoulders to bring your arms down or bring up, have the elbows slightly forward, and that should help protect the biceps tendon and the supraspinatus, as opposed to having your humerus back this way. So there you go. That's kind of like my quick rundown, and I want to thank the two doctors. Let me just get this straight for a second. I want to make sure I get your names right. Sorry about that. Dr. Emilio Landolfi and Rogerio or Roger Bernardez, both PhDs. And again, it's from the ACSM Health and Fitness Journal, volume 28. Number 4, it's the latest edition. I'm pretty sure this is the latest edition, July-August 2024. So, thank you very much. We really appreciate you watching. When you get the opportunity, please follow us on our social media. Please like, share, subscribe. Pass this on to those that you feel this might be helpful for. If this is on YouTube, if you're watching this on YouTube, please hit that notification bell. We really appreciate it. My name again is Alfie Vente of Vente Pain Relief Clinic. And oh, by the way, if you've got any questions, feel free to comment below, or feel free to give us a call at 416-644-8894, or email us at admin@ventepainrelief.com. Our office is at King and Bay, the financial district of Toronto, on the 56th floor of First Canadian Place. Once again, my name is Alfie Vente of Vente Pain Relief Clinic and VPRC.ca. We'll see you in the next video. Thank you for watching. Have a great day.